Welcome everyone, Dylan Gemelli here today with a brand new video for you, and I have a highly requested video today. We are going to discuss everything about NPP, nandrolone phenylpropionate. But before we get into that, just a big shout out and thank you to every single one of you watching out there, subscribing, supporting, commenting, sharing, liking. It's going a million miles. It's feeding the algorithm, it's helping us grow, and we're doing tremendous. So if you haven't yet, please hit the like button, subscribe, share, whatever you can do to support the channel. It goes a million miles to help us grow, and that allows me to do more and more content for you each and every day. Now, our show today is sponsored by letsgetchecked.com. Now, letsgetchecked.com specializes in at-home blood testing, and they do it all. They do wellness, male, female, full hormonal panels. They do coronavirus testing, sexual health. They do it all. It is easy, it's seamless, and it's just highly recommended all over the internet. All that you do is place your order, get a kit sent to you directly. It comes quickly. You can do it overnight, or generally it comes in just a few days. You get the kit, you do your test, you send it right back. You get your results very quickly, and beyond that, you have access to nurses and doctors 24 hours a day, 7 days a week to help you if you've got any questions on your blood work. It is amazing. It's seamless. It's easy. Oh, and by the way, 30% off with that code Gemelli30. So letsgetchecked.com. Check them out. Now, let us talk about NPP. NPP, actually, it's funny because I find NPP to be more underrated and not really used as often, but when people use it, there's such a strong support group for it. And I kind of have the same people that are on me about making this video all the time, and I understand, and I definitely needed to make this video, and I'm kind of glad that you stay on me like that with things like this so that I can make sure that I'm fitting them in as need be. Sometimes I try to get a little fancy and get to other topics, but then I forget about these things that are so important that we need to have references to. So, what is NPP? All NPP is the short ester form of DECA or nandrolone. So you've got to understand the difference with DECA and NPP. It's just the ester. So the NPP ester is a lot shorter, while the DECA version of nandrolone, as we know, is one of the longest esters out there. So you don't really understand, I guess, because you associate DECA if you're not really like vetted on this or understand things. A lot of people associate DECA and they just think it's long, and so a lot of people don't even know about NPP. One of the beauties of NPP is that you don't have to run a longer cycle. Some people feel obligated to run DECA at least 14 weeks because the ester's so long. You know, you can still get great results in 12, but you could potentially be selling yourself a little short by at least 2 to 4 weeks. And the longer the cycle, the harder the recovery, the more likelihood of you losing gains because it's so much harder to recover, more side effects probability. It's just not great to be staying on cycles long term. It's just not the wisest idea, especially for down the road. So with the NPP, you can inject it every other day, every 3 days at the most. But I prefer to keep it every other day, but you can get away with either one. The main reason NPP never became as popular is because of the availability and the small amount that the original versions had per milliliter. You know, DECA came 200 milligrams per milliliter, so people found it a lot easier to just be injecting 200 milligrams twice a week in the 1 milliliter injections. But now with UGLs and different people producing it, you can get a wide variety of concentration levels on it. You got to understand half-lives, though, and what they mean and what we're getting at here. So if you're putting it in simple terms, NPP is going to be a lot quicker to build up to peak levels in the body, and it's going to be quicker once you stop injecting to filter out of your body. Where DECA, because of the really long ester, it's going to take a lot longer to build up, and it's going to take a heck of a lot longer to get out of your body. So it's going to cause a longer recovery, as I was talking about. So it's a poor choice if you're trying to keep cycles under 10 weeks and you want to run multiple cycles a year. And NPP would be the far more desirable and realistic option. DECA is going to take about 6 weeks to clear out of your body, and it's going to be detectable for up to 18 months. NPP is going to clear out in roughly 2 to 3 weeks. And that's a big difference there when you're talking, 4 weeks and more where it's clearing out of your body. Now, a slight advantage with NPP is that some people do say the injections can be a little bit more painful. That's hit or miss. But when you have a shorter ester, chances are good that there's going to be a little bit more pain in there. But it also depends on quality of gear, the carrier oils used, the concentration levels. So there's different factors there. But it's not on my list of most painful injections, but it could be a little bit more painful. But let's take a look at it as a whole. Nandrolone is used to treat anemia, so logic says it would be very good at raising RBC count, which is then going to help the delivery of oxygen to muscles. It's not a tremendous amount, but it does the job. There's some aromatization, so an aromatase inhibitor is recommended, but it's going to aromatize about half that of testosterone, possibly even less. Now, in the medical community, NPP and DECA is actually used to help treat AIDS patients. Excuse me, I can't spit it out. Because it's going to help to preserve muscle. It's going to fight off that muscle wasting that we know does go on with a serious illness like HIV and AIDS that's attacking your immune system. And you should be safe to assume it's not going to hurt your immune system and possibly boost it if you're giving it to AIDS patients who are obviously suffering from that issue to start with. It can also help improve collagen synthesis, and that's why so many people use it to help with joint pain. I'm not a proponent of that because it's like a band-aiding a wound. It can backfire, but many people do it that way, and hey, it does help you while you're using it. There's nobody that's going to deny that. I just don't like that it's kind of masking a wound and that you're beating up on a wound and can't feel that you're causing more pain to it. But it does absolutely provide you relief while you're using it. Just remember, you can't stay on it forever. Another thing that you want to keep in mind, nandrolone isn't super androgenic, and it's slightly more anabolic than testosterone. It's actually pretty mild with less side effects if you run it properly. One of the things that I do stress is DECA and NPP are very, very clean if you run them properly. People are blasting too much test or having terrible diets because they think they're bulking on it. And that's fine to bulk on it, but you don't have to do this. I don't care if I'm bulking what I eat. Okay, you still eat good food, just more calories. So, but there's so many factors that play into this. Running the NPP or DECA too high. Not controlling estrogen when they're using testosterone alongside. These are reasons why people are holding water. And if you run DECA NPP properly, and when I say properly, I mean maybe a little bit more conservative. Don't exceed 400 milligrams a week. Get the most out of it with the least amount of side effects. That's kind of what I have always stressed. And I will always believe in that and stand by that. So just keep in mind, it is a lot more mild than people make it out to be. Just be careful with what you stack with it, what kind of doses you're running, monitor your blood work. And it's going to be trial and error from person to person. Some people tolerate a little bit more, a little bit less, higher test, lower test. I've always said keep the dosing equal. I generally recommend that 300 to 350 milligrams each of testosterone and DECA or NPP. That's what my recommendations generally are. I really, in very, very rare circumstances do I recommend it over 400 milligrams a week. 500 milligrams would be the absolute tops, but you're not going to see, when I do cycle layouts or I do videos, you're going to see, just like now, my recommendation is no higher than 400 milligrams. And 12 to 16 weeks, 14 to 16 is really good, but some people don't like to exceed 12 weeks. You'll still make. Now, with NPP being a shorter ester, the beauty of it is you could go 8 to 10 weeks on it, and it's like running the longer cycle. So this is an answer to so many people that just don't like DECA because of the length of time you got to run it and kind of how long it lingers, because you can tell it's lingering when you're off of it a little bit. Not tremendously, but a little bit you can. So it's very, very, very desirable to people wanting to run those shorter cycles, and you just run it with test propionate, do your short esters, and boom, get in and out 8 to 10 weeks. Then get recovered, rested, and then you can be. See, the people go, well, if I run these short cycles, I'm not on very long. But here, think about this: you run a short cycle, your time off cycle is far less than when you're running these really extensive cycles that you're going to need a huge amount of time off on. And if you think about it, you're on more often. You might have to pop off, but you're on more often, so you're kind of feeling better and making more gains throughout the year, as opposed to running these long cycles that will eventually stall out and then require you to be off for so long. So just keep that in mind. What's a classic cycle here? A classic bulking cycle: test prop, NPP, and D-ball. That's it. You could run D-ball the first 4 weeks of your cycle, run test prop and NPP 8 to 10 weeks, run them both 100 milligrams every other day. That's your test prop and your NPP. That's going to come out to about 350 milligrams a week. Perfect dosing. Make sure you're watching your prolactin levels because of the NPP. Make sure you're controlling estrogen on cycle, and make sure that you're protecting yourself from the toxicity with D-ball. And that's the kind of ancillaries and protectants that you need on cycle. So let's look directly at NPP side effects. So NPP can hurt your cholesterol, can cause some mild alterations in your LDL and your HDL cholesterol scores, and that can provoke elevations in blood pressure. But the risks of developing things like heart disease with using DECA or NPP are relatively low, so cardio effects are going to be more mild, cardiac effects. Now, all anabolic steroids can have a negative effect on blood lipids because they're all essentially forms of exogenous testosterone. So DECA is among the most cardiovascular friendly out there alongside testosterone. Then there's the potential for some low sex drive. It's infamous for its sexual side effects. And that can be a decrease in sexual desire and performance, and that can lead to erectile dysfunction. And you'll hear that often associated with this. Now, the reason why men may struggle to get an erection on NPP is due to its deficiency in androgenicity. All right. Now, androgenic steroids are going to facilitate nitric oxide production, which is crucial in the role of supplying blood flow to the penis. So DECA may compromise circulation in this regard. Now, it also raises prolactin levels, and I spoke about that a second ago. And that's a lactating hormone, and that can decrease arousal or sexual interest. Now, the combination of low nitric oxide levels and high prolactin is just a disaster in the bedroom. You can combat this by stacking NPP with an androgenic steroid. Something like testosterone is a prime example. Now, you should always have something on hand for prolactin. Caber, Dostanex, or Pramipexole is the ones that you're going to want to have on hand. But if you're running a lower dose, you can probably get away with vitamin B6. Proviron is also another strong addition to aid with this issue as well. I would recommend running it 50 milligrams per day. You definitely should be running Proviron alongside here. Low testosterone levels can also occur when using DECA because it's a suppressive steroid, so you are going to need a full post-cycle therapy. Now, let's talk about the estrogenic side effects and more into progesterone. So, DECA is going to be a lot less estrogenic, NPP. Some people say 50%, some people say as low as 20%. Aromatization of testosterone. But you can experience estrogenic-like side effects, especially because it can, possibly increase your progesterone levels. Now, progesterone is a female sex hormone like estrogen, and it has a stimulating effect on breast tissue and the mammary glands, potentially causing gynecomastia. So, in an AI aromatase inhibitor like Arimidex or Aromacin, is going to want to be used on cycle, okay? Especially because we've got the estrogen conversion going on. And be careful with your test doses, okay? Because even though the DECA NPP converts at a lower rate because of the prolactin issues there that are present as well, you don't want these ratios getting too far out of hand. And it can easily happen by people not understanding how these actually work and the risks involved. And a lot of people, when they go get blood work done, let's face it, they don't know what they're doing, and they don't get full panels, And even though you're getting a full hormonal panel, something like prolactin and progesterone, they're not involved in your normal hormonal panel. You have to request those separately. So keep that in mind as well. Women should just flat out avoid using DEC or NPP. I've talked about this several times in the past. Just simply, it's not something I would recommend whatsoever. So, and that's really it with your NPP, which is just a short, firm version of DECA, as I said. Nandrolone phenylpropionate. It's a short ester, to sum it up. Every other day pinning, possibly every 3 days. My recommendation is 100 milligrams every other day. That'll put you at about 350 milligrams a week. That's a very good dose. You can make good gains even at 250 milligrams a week, and I promise you that you can. It's not going to be major significant, but you'll definitely know that you're making progress with it. All right, so, but NPP, very intriguing, loved by many, used by many, and with good reason. So, that being said, stay tuned for plenty more to come. Dylan Gemelli, signing off.